One woman physician told me, you know, you're a good internist. You don't have to take care of these people. Which, of course, is who's going to take care of them? It was terrible. We had no specific treatment. There were so many complications, pneumocystis pneumonia, cytomegalic virus infections, and resistant tuberculosis, and all those weird diseases that we couldn't treat. Kaposi sarcoma, of course, but that wasn't a fatal part of it. So it was very difficult, and many of the patients were either self-employed or uninsured. So I made lots of house calls. And the awkward part of it is, when I did put them in the hospital was scared to death of them and required gowning and masking and all that stuff on the earlier patients. But once I convinced them that this is not necessary, that was relaxed, thank God. When they had conferences on it, trying to figure out what was going on, I remember I spoke up and said that this is being transmitted by anal intercourse, just like hepatitis B. And one of the physicians who was working on AIDS came up to me and she said, it was a physician, a female physician, she says, "Oh, thank you for bringing that up. I knew that, but I couldn't bring myself to say it."
Were you one of the earliest that put it together?
In my mind, I was, yeah. The hospital director, medical director, had several cases of hepatitis B in his employees, and he found out they were patients of mine. So he came to me and he says, does this mean I have to immunize all of my employees now? And I said, no, they got it from their lifestyle, not from the hospital. So it saved him thousands of dollars. One of the surgeons at our hospital said, that patient you sent to me was very interesting, but he sure walked a foot off the floor. In the beginning, they were all afraid, and so I ended up getting the whole load, as far as I know. We had international conferences on AIDS that were occurring around the world, and I always attended them, and I learned from some of the physicians who were attending that through studies that were going on, that this AZT looked very promising. So I got myself set up as an independent investigator so that I could use it on my patients, which did delay the progression of the disease, but it made them severely anemic. And that became a real problem with the blood bank because I was transfusing them over the physicians, the surgeons' objections, because they needed blood for their surgery, and they didn't think that drug addicts and AIDS patients should be taking so much blood. I was out to my patients, but not publicly. Well, I warned them that they had to take protective anal sex. I wasn't worried about oral sex because that didn't seem to be a problem. My very first patient, this was a sad story, he was a very respected school teacher, and there were a lot of wonderful eulogies for him. And when the minister who was performing the service finally said, "This is a wonderful man, sorry to lose him. Too bad he had to go in disgrace," because everybody knew that AIDS was a disease of gays or drug addicts. That was hard to put up with, to think that these guys were dying in disgrace. I had a very young, promising architect who had both pneumonia and renal failure from the disease, and we had him in intensive care, and it was costing his family thousands of dollars every day because we had him intubated. He had to write notes, and he asked me one morning, "Will I ever get out of here?" And I said, well, not with our present technology. He said, give me 2 days to say goodbye to everybody and then pull the plugs. The family agreed to this, and so that's what we did. And when I had to pronounce him dead later, the family had to support me rather than vice versa. It was very difficult.
And you probably have many stories like that.
Yes, because many of them were my friends. Sorry about this. Many of the families resented the fact that this is difficult, because they found out that their sons were gay and they didn't know it before. Being a friend made it much more difficult emotionally to see the extent of this illness. But it also made me work harder, perhaps. I put in very long hours and made extra house calls that I might have been able to refer out otherwise. Any death from any disease is very difficult. But I think it was especially difficult from AIDS because these were, for the most part, young, healthy people when they got it. There were no treatments for most of the complications, so it was a terrible situation. Most of the things that people die of, we either have treatment or they're older people that were going to die anyway. Well, I feel like I did my share. I don't say that I was proud. I happened to be in the right place at the right time to help out.